Hi my beauties, welcome back to Younger. Today I'm going to be talking about dermal fillers. So the reason why I want to talk about dermal fillers is this a very common procedure that I do in my practice, and patients often have a lot of questions, and there's so much out there. When you do your research, it can get really confusing on which dermal fillers do what, how do they differ on a molecular scale, and what fillers are injected into what areas in the face to achieve certain goals. So it can be overwhelming if you're following different people and you're doing a research and you come across different products and how these products all differ and what they're engineered for. So the whole filler market has been revolutionized over just the last 5 to 8 years, and we have so many different fillers to choose from now. We're like artists, where before we just had watercolor, now we have oil color, we have watercolor, we have acrylic paint, we have all different colors, and we can do all different sorts of things with these different fillers. So now we're artists with different tools in our armamentarium and different fillers that we can use to be injected into different areas of the face to achieve different goals. Now everyone has a different aging process. You can look at your parents and your grandparents to kind of see a snapshot in the future to see what you're going to look like and kind of be preventative and try to prevent these changes from happening before they happen. But the way we age is different for everyone, not just depending on your age, your ethnicity, your lifestyle habits, where you live, your water intake, your ultraviolet light exposure. So many of these things will age us differently, and some patients may come in and be 38 years old with 0 wrinkles naturally, and some 24-year-olds will come in with already fissured lines or early signs of aging, just depending on their ethnic background, the amount of melanin pigmentation they have in their skin. Do they live on the beach? Do they live at altitude? Do they live in, in a country where there's not that much sun exposure? So all these things differ, and when each individual patient comes in, I just do an assessment of their face and how they're aging and kind of go over a plan with them, holding a mirror in front of them, saying what changes do you see and what do you want to correct and how can we achieve these goals. And there's a lot of technology that's out there today, and there's a lot of techniques when injecting that just comes from years of experience, not only from rotations in medical school or residency or fellowship or post-fellowship or postgraduate training, where you really can learn how these different tools can be used to achieve these really amazing goals and to make it look natural. I had an attending at UCLA that used to say, you never see good filler, you only see bad filler. So if someone's walking around looking goofy or overdone or not like themselves, chances are they went to a non-expert injector who is maybe using the wrong product in the wrong area of the face and injecting with an improper technique. So there's a lot that goes into that. You can give 10 different people a paintbrush and a canvas, and they're going to paint a different art form, and it just depends on the level of skill and training, and that just comes with years of experience. So I don't want people to be turned off from having these procedures done when you see these bad outcomes, because this is not what filler is supposed to look like. Filler is supposed to be very natural and enhance your natural beauty and keep you looking your best at every age. And I know I always use J-Lo as my example, is she's done it right. She does little successive approximations to her goal. Any little signs of aging, she jumps on it right away. She doesn't wait and not do anything and then try to do some big dramatic surgery or treatment that's going to alter the way she looks. So that's why it's important. Sometimes patients will come in and they have like the marionette lines and they don't have any wrinkles under the eyes. Or sometimes people will have no signs of aging on their lower face, will have these sunken bags under their eyes, or these hollow temples, or these jowls. So there's different things that people get, and when you just assess the human face and you look at the changes that are happening as you age, you can address these in baby steps, and that's what keeps you looking very natural and your best, and is more of a preventative, more of a proactive versus a reactive approach. So what I like to explain to my patients when they come in and we talk about different fillers, fillers restore volume. There's fillers that restore volume by a mass effect, meaning when you inject them into the dermis or the underlying structures of the skin, it expands inside the tissue and it lifts and pulls and will kind of lift up on the lower face if there's laxity. It will fill in the fine lines and wrinkles, and it will have a mechanism depending on where you inject, how deep you inject, and the molecular configuration of the dermal filler itself. There's also stimulant fillers like Sculptra. Sculptra is polylactic acid, and what it is it's a precipitate form that's resuspended in water, and you basically inject it into the face. So when people like a lot of my athletic fit patients who are young, but they look older or skinny or cachectic or unhealthy because they have sunken faces, because they're losing so much weight in their face, it ages them. Even if they're 30 years old and they're totally ripped with like 5% body fat, they have these like old faces because they're sunken. When you do Sculptra in these people, it basically, when you inject it, because it's mainly water, it gives a swelling effect, so they temporarily look good, then the swelling goes away, and then it kicks in your body's own regenerative processes to stimulate the synthesis of hyaluronic acid, collagen, elastin, and restore that volume. So what happens is it's almost like a peak, a dip, and then another peak. So when we do the injection, they look great, they leave the office, then the swelling goes down and they go back to their baseline, and then a couple weeks to months, maybe 2 months later, it starts to take effect, and they'll get this really beautiful natural enhancement because you're inducing your body to do the work to make this volume. It's not like you're going in an OR and having, you know, a nip, tuck, pull, and suture, and you come out of the OR looking different. So I like Sculptra as a stimulant filler because it stimulates your body to make the volume. This is different than hyaluronic acid fillers. Hyaluronic acid is basically the ground substance of our skin. Babies have a ton of it. Kids have a ton of it. That's why they have these nice, round, full, fat cheeks. And we start to lose that starting in our 20s, and it continues on in your 30s and 40s unless you induce your body to make that volume back. So hyaluronic acid-based fillers are usually the mainstay of therapy. Usually most dermatologists and plastic surgeons use hyaluronic acid-based fillers because they are reversible. Now, when you inject hyaluronic acid into the face, you don't have to worry about allergy or these bad side effects because it's a natural sugar that occurs in the skin in nature. It's a natural ground substance of our skin. And so we inject this filler into your skin, and your body kind of incorporates it into itself. It thinks it's its own. And the filler actually integrates into the tissue very beautifully and very naturally when done correctly, of course. And what happens is if somebody doesn't like the filler, or they change their mind and they don't like the filler the way it was injected, you can use something called hyaluronidase, which also goes by the name Vittrace, and you can dissolve the filler. Now the filler is going to be dissolved when you inject the Vittrace, and it won't harm your own your own natural hyaluronic acid. So people will always say, I had this filler and I don't like it. And usually it's a referral from an outside doctor, a patient who doesn't like their filler. I have to dissolve it all and then start with a clean state and put the filler in where it needs to be, where it's supposed to be injected. And patients always ask, well, Dr. Keppel, if you're going to inject the hyaluronidase, I don't want it to eat up my own hyaluronic acid. It knows when to stop, and your body has a threshold of where it wants to be. So even if the hyaluronidase were to eat up your own hyaluronic acid, your body makes it back to its baseline. So never worry about the hyaluronidase or Vittrace that we use to dissolve filler to affect your own hyaluronic acid. So that's a question that often comes up among my patients. So moving forward, talking about hyaluronic acid-based fillers, these are the more common ones. Juvederm, Juvederm Volbella, Voluma, Velour, Restylane, Restylane Silk, Bellotero. These are all hyaluronic acid-based fillers, and they're usually the most commonly used because they're reversible and because they're a naturally occurring substance and because they integrate into the tissue so beautifully. So there are other fillers that are less commonly used. Some people use Radiesse still. We actually use it a lot more in the hands, just to kind of fill in the hands when people get all tendony and skeletonized. As the muscles in our back of our hands become atrophic or they shrink as we get older, you can start to get bony and tendony and veiny in your hands, and we use Radiesse, which is calcium hydroxyapatite, which is basically bone matter, and we use that to inject into the hands. It does really well in that area of the face. Some of my colleagues use this in the hands. Some of my colleagues use this in the face as well, but it's a less commonly used one because A, it can't be dissolved. It has to just kind of wear out over 1 to 2 years. And B, I personally don't like it as much as an injector. I don't think it's as natural, or it integrates into the tissue of the face as well as other dermal fillers. Plus, if you ever get an MRI or any imaging, if you ever have some type of medical evaluation, it shows up on an MRI, which looks kind of funny. I remember on my radiology rotation in med school, I saw some lady in a car accident and she had all this radius in her face that lit up on the MRI. It was kind of funny. But anyway, so moving along with the dermal fillers, when you look at the hyaluronic acid-based fillers, and this is what I'm going to spend the majority of the time talking about because they're the most commonly used. So as an injector, I really like the new Juvederm technology. So this is the Vicross technology. Hyalocross technology is old school Juvederm. Juvederm Ultra, Juvederm Ultra Plus, Juvederm Ultra Plus XC. This is what I used like years ago when I was in medical school. So the technology now is so much better. The molecular configuration of these dermal fillers in the Juvederm Voluma Volbella Velour profile, or the more commonly used, fillers that we have on the market now with advanced technology, the cross-linking of the molecules is different, so it lasts longer. It lasts 18 months now, and it actually lasts longer than that. Anecdotally, when patients come in after 18 months, they still have their filler in place. So I think it lasts about 2 to 3 years sometimes in some of my patients. Sometimes people, especially if they're very active and fit, will metabolize it faster. But even so, it's usually their own volume that they're losing because they're now 35, not 32 when they come over, or 45, not 42 when they come in. And so the filler is supposed to last 18 months. Now, the FDA studies went 18 months, so we can't, as doctors, say to our patients that it lasts longer than 18 months, when anecdotally, like I said, it does. Usually patients come in and the filler is still there after 2 years, but a company and doctors can't claim that it lasts longer than that unless the studies went past 18 months. Now, when you do a randomized controlled trial or a head-to-head double-blinded study, when you're getting FDA approval for these, you're in phase 3 trials for these pharmaceuticals or these injectables, you have the patients come back at 6 months, 12 months, 18 months. Well, after 18 months, people move away. They're sick of coming and filling out questionnaires. They're sick of logging in online and taking pictures and doing evaluations. So usually the studies don't go longer than 18 months. So we can't medically legally say that the fillers last 18 months or longer than 18 months when actually they usually do. So moving on, talking about the advanced technology and the Vicross technology. So Juvederm and the Juvederm XC, all those are the Hyalocross technology, are a little bit more old school. So what's the difference between Voluma, Volbella, and Volure, which are the new technology, the Hyalocross technology? Besides the molecular configuration, making them look more natural, integrate into the skin tissue better, and lasting longer, they're all engineered to be injected into different areas of the face. So Voluma is more of our workhorse filler. If you think about Voluma is more like Jell-O. If you think of Volure, that's more like toothpaste, and Volbella is more like water. So you wouldn't want to inject the same filler into the cheekbones to give someone a non-surgical facelift where you're going to lift up from above. You wouldn't want to do that very viscous, thicker filler that you would inject over the bones to lift and pull that you would do in like the lips, for example. Say, somebody wanted tear trough filler in the delicate under eye area, or they wanted lip filler for lip augmentation, you're going to use Volbella, which is a finer, more watery consistency. It's like more of like the icing on the cake, and like the the Volure and the Voluma are like the cake. So I hope this makes sense, but it's kind of like you could think of it as small, medium, large with respect to how thick they are. And so Volure is more of the middle of the road. It's not too thin, not as thick as it's not as thick as a Voluma, but it is engineered to go like in the marionette lines and the nasolabial folds. These are the marionette lines. These are the nasolabial folds. And the Voluma is injected into the cheekbones, more into the temples for temporal hollowing. We sometimes even do Restylane is another hyaluronic acid filler that's kind of on the same consistency and thickness as Volure. We do that along the angle of the jaw to pull back when you have jowls or you have laxity in the pre-jowl sulcus. So these fillers are different thicknesses and they do different things, and they're injected to different depths of the skin. So just to kind of go over it again, Voluma goes here, it's periosteal, it's right over the bone, and it goes along the cheekbone here, or it goes along the angle of the jaw here to lift up in this area. Volure goes in the nasolabial folds here or in the marionette lines to kind of fill in those folds, and Volbella usually goes in the tear trough area where the lid-cheek junction starts to separate. As the fat pads underneath our skin start to separate, you get a tear trough here, and sometimes anatomically people can have it. I know I sometimes look at Riley, my little 5-year-old daughter, and she has a little tear trough there. So you can have it anatomically, but as we get older, the fat pads underneath our face start to separate, and so you start to get a space here called the tear trough. You also get one here called the festoon. So different fillers are engineered to be injected into those areas to fill them up and to kind of make a smoother transition. So if you look at a child, usually they'll have a smooth transition from the lid to the cheek, and when they don't have it, it can age us. So we add in a little bit of tear trough filler there, and that is usually done with a thinner filler, which is like Volbella. The other tear trough or lip fillers that are commonly used are the other finer, more thin consistency fillers are like Bellotero, Restylane Silk, and Vobella. So these are usually the ones that I use most commonly. I'm a big Vobella fan, and you know, successive approximations to a goal is always key. When my first time lip filler patients come in, I usually ask them to bring some photos, or I just let them do my thing, let them have me do my thing, and I just basically enhance what God has given them. So everybody's lip anatomy is different, and so you just add in the filler just to kind of augment what their normal lip anatomy is capable of holding, and not beyond that, to not make them look overdone or have that fake look, or have that, God forbid, the duck look, which would never happen with me, so you don't have to worry about that. But basically these thinner fillers are engineered for those areas. And then I just also kind of wanted to touch on the different ways we approach the aging face and how to put fillers into the face. So I always tell my patients that skin is like a tablecloth. And if you watched me on Brianna Stanko's YouTube channel, I talked about this on her channel as well, so I apologize if it's being redundant, but basically what we think of the skin is like a tablecloth, and underneath there's a table. So as we get older, we lose the subcutaneous tissue, and it gets thinner over time. So as the table starts to thin, the tablecloth that's resting on top of the table starts to sag. So when you build up that table and add in more volume, this tablecloth starts to be lifted up again. So you think of the skin draped on the face, and underneath the skin you have the subcutaneous fat, you have muscle, you have bone, even the orbital apertures of our skull get bigger. So like the kind of the eye socket, I guess what the layman would call it, gets bigger over time, and so everything starts to thin out underneath the skin, so the skin starts to sag. So you do things like Sculptra, you do Voluma here, Sculptra here, you do Restylane back here, or Voluma back here, you do Velour right here, Velour here, Vobella in the lips. And you don't do it all at once. You just basically address one issue, have the patient respond, have them come back. If you need to do a little bit more, you just do these successive approximations to a goal, and it always, without fail, keeps you looking natural, and you get little successive improvements each time you come in. So I can get a patient to look 10 years younger, but in like 6 different visits, or maybe even 4 different visits. So the reason why we do it in baby steps is because you have to allow your body to respond, and then you address it again. You kind of re-equilibrate and add more if you need to. It's kind of like going to the gym. I know I always talk about dermatology and fitness being a lot alike, but they really are. You're not going to go to the gym once for like 6 hours and then never go again. You're going to go and you're going to do a good workout for about an hour and a half, take a break for a couple days, go back, take a break, and then that's how you basically, you're building, you're making your body respond appropriately, and you're naturally enhancing the volume or reversing the aging process. So the approaches are different too. So most commonly when patients come in, their biggest concerns are the tear trough area, the nasolabial folds, and the marionette lines. Now before, when I say before, this is years ago, we used to just fill in these areas to try to make them look better. But now that we have a whole different appreciation for how the aging process occurs, and Rebecca Fitzgerald, who's a world-renowned dermatologist and one of my professors and mentors at UCLA, she actually was the first one to teach me this when I was a brand new first-year resident at UCLA, and I'll never forget this, but it was genius. As people age, you have to address the problem, not the symptom. So when patients would come in saying, I have these nasolabial folds here, she would basically add filler here to lift up in that area to soften these lines. Then she'd have the patient come back, and if there was any more, we would add filler here to lift from this vector. And then if there was still a complaint with the nasolabial folds there, then we'd add a little bit more filler here. And it just was really eye-opening for me as a young student to see that, and I've incorporated that into my practice over the years, and it really works. It's really great because you're not just treating the symptom, you're treating the problem. And then at the end, if the symptom still remains, then you add, filler into that area. Now, of course, everything's on a case-by-case basis, and medicine is an art form. Now, patients that come in and they want a quick fix, or they're really young and they hardly have any volume loss, then sometimes we'll just go ahead and fill in that area. So, don't hold me to every word I say, but everything is different. Like I say, medicine is art, and it's different for every individual aging process, and how each individual responds to each individual filler. So what filler is right for you may not be the same as your friend, or even your mom, or your sister, or your loved one. So it just depends, and it's important to just take it slow, allow your body to respond to the filler, go to an injector who knows these fillers well and has a whole array of them available in the office. Sometimes people are just, maybe in another area of medicine, say I'm an ER doctor and I'm trying to start a med spa and I'm going to buy 200 boxes of Juvederm and that's all I have and I'm going to put Juvederm everywhere. That's not the person you want to go to. You want to have a person or an injector who has every filler available to them and can pick and choose what filler goes in what area of the face. Now, usually we use, fillers come in quantities of a syringe. Sometimes Vobella, for example, comes in half a syringe. When somebody comes in for their first time lip filler, sometimes I do a full syringe depending on the patient, but sometimes I just stop with just a little half syringe of filler so they can kind of get an idea, see what it's like, see what the after swelling is like, and if they get swollen or if they don't get swollen, then they know when they come in they get the other half. And so I'm very conservative despite the fact that I'm a surgeon, but I feel that I've had the most success this way, and if I can educate you guys to kind of have that mentality when you go into an injector, if you don't see me, just kind of have that in the back of your mind. There's no rush, and it's better to take your time and go slowly with these fillers and just to customize each treatment and each filler product that's chosen for your individual face and what you're looking for. Now, sometimes I'll hold up the mirror and I'll say, okay, what is it that bothers you? And I'm assuming that they're going to say, these huge tear troughs under the eyes. And they'll say, no, that doesn't bother me. It's these marionette lines that bother me. So I always listen to the patient. What bothers you when you look in the mirror is what you should be addressing with your doctor. Don't let your doctor push you one way or another or say, oh, that's fine. Why don't we put filler here? At the end of the day, beauty's in the eye of the beholder. And when you look good, you feel better and you're overall healthier. So that's my main advice, is to make sure you kind of have an idea when you go in to see your injector what you have in mind, what things to look out for. Check the credentials of everyone. Make sure that they're an equal opportunity employer. They use every single filler that's on the market that they have access to. And if they choose one filler over another, question them. Say, why are you choosing this one and not this one? And so I think that's really valuable to have that kind of knowledge and background and go into the office visit knowing that. And so I can do videos subsequently on each individual filler, like I can do probably a whole video on just lip filler and how to give a very natural, beautiful enhancement without looking overdone and without looking like someone other than yourself. You want to look like the best version of yourself and put your best foot forward, but you don't want to look overdone or like someone else who's not you. So I think I covered everything. If I have not, leave a question or a comment and I can do a subsequent video kind of looking into the different other details of dermal fillers. But I hope this was kind of like an overall ballpark overview of dermal fillers, and I hope that you guys learned something.